Starting Monday, you can get free COVID tests again.
Oh, yeah, the government's relaunching that program amid a spike in cases. You just have to go online to order them. Dr. Mina Sinakori is president of the Harris County Medical Society, joining us now to talk more about how it's affecting us right now in the Houston area. Welcome. Thanks for being here. Let's just start with to figure out what it's looking like in Houston right now. What is our positivity rate?
So right now it's low, about 4%, but we do anticipate some surges this fall, so we're on alert.
All right, so people can start ordering these tests again on Monday. They get 4 tests within their family there, and it's just a website, right, where you go and order them?
Yes, covidtest.gov, and starting Monday, September 25th, it's 4 free tests per household.
Well, that could save people a lot of money because they do cost something. And then the thing is that the testing, you want people to test because it's so hard right now to tell. Do you have the flu? Do you have allergies? How important is it to really know if it's COVID?
Yes, because sometimes the symptoms are indistinguishable from the common cold or other flu-like illnesses. It's important to test so that you can know to isolate if you are COVID positive. And for our most vulnerable patients, our immunocompromised patients and our elderly patients, they can seek care with their doctor early so that they can get antiviral therapy to reduce their risk of serious illness.
Doctor, when do you recommend people test? Is it as soon as they start sniffling and feeling bad? What symptoms are you kind of looking for to test?
Sure. If you're symptomatic, you should test then, and then 48 hours later as well, unless you go for the PCR test, and that can be more accurate. And if you are just exposed, you want to consider testing 5 days after exposure. Repeat 48 hours if you're using that at-home test.
I'd like to go back to what you mentioned just a moment ago when you said if you are immunocompromised, there are treatments available versus just waiting, like you would do the flu perhaps, and just seeing if you get over it. What are those treatments like now? Because in the beginning we were seeing people getting IV treatments, then they were taking a lot of pills. What is the ideal treatment for COVID right now to make sure you don't get long COVID or other problems?
So in consultation with your physician, Paxlovid is a good example of an antiviral therapy that may be used for our elderly patients or immunocompromised patients or patients with other chronic illnesses and other high-risk conditions.
Most of us, doctor, have gone back to living like we did pre-pandemic. What do you recommend for people who are going to work or have things planned and one of their family members tests positive? Are you supposed to stay home if you're not symptomatic but your family member has COVID?
Sure. So we do consider that you get testing, and if you have a high-risk exposure, that you can isolate. But certainly we recommend testing 5 days after exposure, and you can wear an N95 mask, especially if you're going to be around patients at the highest risk for serious illness.
Let's talk about what to do, because it's been a long time since a lot of people have had to deal with the diagnosis of COVID. Do you go with what your doctor says? Do you go with what your boss says? Find something in between? Is it still that 5 days of hiding out in your home by yourself? What do you suggest?
So certainly if you have a more serious illness or you're still having fevers, then your isolation period will be longer. Okay. And certainly listen to your doctor, and there's good updates always on the cdc.gov website.
Okay. Anything else you want people to know or to take away as we head into the weekend, doctor?
So, they can certainly go to that website and get those tests. And also, we have flu this season, so important to get your flu shots because that's just one more viral illness that we can reduce the risk of in our community.
And it's just so cliche because we were so sick of hearing for a while, wash your hands for 20 seconds, but at the end of the day, is that our best defense? Because I don't think a lot of people are really into wearing masks again these days, it seems like.
Hand washing, avoiding touch your mouth, nose, and eyes, and staying home if you're sick with COVID to protect our community are very, very important for everyone.
All right, we want to keep that positivity rate low at 4% in Harris County. Thank you so much for coming in.
Thank you.
Have a good weekend.
All right, you ready for this? Local legends are uniting for a golf tourney.